Hello, welcome to all with another video. So this video will be about the colors of the baby poop and what they indicate, like for the normal public and those for the junior doctors. They must know what the color of the baby poop can lead towards. What can be the possible causes, what can be the differentials in such a case. So normally the color of the baby, once the baby is born, so the first stool that the baby passes is the meconium. So meconium is usually dark green in color, is having somewhat granular appearance, maybe having somewhat black staining, right? So if at birth the baby passes green stools, dark green stools, so it will be normal, it will be the normal meconium that the baby is passing. After that, once the baby is started feeding, and for the first 6 months the feed is the milk. So either the breast milk, or if the breast milk is not there, baby may be on some formula milk, or in some cases in the developing countries they are usually given the diluted cow milk or the goat milk. So when the baby is taking the milk and is purely on milk feed, so the stool will be of yellowish color. It will be yellowish color, may have granular appearance, sometimes may have a loose consistency, and sometimes what happens that with each feed the baby passes a small amount of stool, which is known as the gastrocolic reflex, and is taken as normal in the neonates. So normally the color while the baby is feeding milk, so what happens that the color is yellow. Then comes the green color. When are you going to see the green color? So the green color is usually seen when the baby is on having some sort of infections of the gut, like if having some sort of viral gastroenteritis, mostly caused by the rotaviruses. So in that case the loose stools will be there, and they will be having a watery consistency, but the color will be light green or somewhat a bit dark tinge to green color will be there. So, or in sometimes maybe because of in cow milk protein allergy, the baby is also having diarrhea, so the color will be green in that case too, and can be because of certain medications, or if the baby after 6 months is on some colored foods, so the color of the stool may change according to that food substance, but that is not much frequent. The major cause is whenever the baby is having green loose stools, you must think of viral gastroenteritis in babies. Then comes the red color. So the red color indicates that the blood is being passed into the stools. So if the blood is coming in the stool, it is a danger sign. It may indicate either the baby is having some sort of gut infection like dysentery, bacillary dysentery, or in cases when there is severe diarrhea with very frequent passage of stools, there may be some blood stains. So in that case antibiotics will be needed to treat the dysentery. In case of viral diarrhea with very frequent passage of stools, and if some sort of blood is coming out, you need to observe the baby. If or not the baby is developing high fevers, or more blood is incoming in the stool, or the baby is in severe pain or discomfort, or there are periods in which there is intermittent severe in crying, in which there is inconsolable cry, and the baby is basically pulling the legs towards the abdomen. So in that, and if the stool starts developing some sort of jelly consistency and becomes so much red that only the blood is coming out in the form of currant jelly stools, so it mostly signifies intussusception or bowel obstruction. So it is an emergency, so immediate workup and treatment is required in such cases. Otherwise the baby may get into the sepsis and shock, and bowel perforation may occur in such cases. Another very important cause of brick red stools, in which there is intermittent episodes in the which the baby or the child is passing some sort of brick red stools, associated with sometimes with pain abdomen, and in the long term the baby or the child may develop some sort of anemia because of the recurrent episodes of blood loss. So this signifies Michel's diverticulum, and you need to think of that, and workup for that is required because the treatment for that is surgery. Another important cause is rectal polyps, in which there is recurrent episodes of the blood coming out. So when the blood is coming out, fresh blood is oozing from the anus, with or without the stools, so it mostly signifies rectal polyp, and workup for that is required, and the treatment will be the resection of the polyp. uh, in some cases, if the baby is passing very hard stools in the form of constipation, that hard stool may cause some sort of injury in the lining of the gut and the anus, and it may cause fresh blood coming out alongside the stools or following the stool, which is usually seen in patients with anal fissure. Okay, then comes the white stools. So white stool, if the baby is passing white stool, so it is, you must think of liver diseases. So it is a thing that must raise the concern, as if the child is having some sort of liver disease, especially if the baby is having prolonged jaundice, conjugated hyperbilirubinemia, or his failure to thrive, and you can see the abdominal distension and hepatomegaly or splenomegaly, visible veins, or there's some sort of sequelae of CLD. So in that case, it raises the concern of obstructive jaundice. So in obstructive jaundice, as the biliary pigments are not being excreted into the stool, so the stool may be colorless, may be white in color. Sometimes the stool may be light yellow. In such cases, you need to cut the stool, and you will see that only the outer lining is yellow but the inner core is white. This is because some intestinal epithelial cells that basically coat the stool, and the stool appears light yellow in color. So if the stool is light yellow in color and the baby is having jaundice, so you need to rule out by looking for the inner part of the stool, whether or not it is yellow in color or it is white. So if it is colorless, it is very light yellow or a creamy white, so it will indicate that the baby is having obstructive jaundice. Then comes the black colored stool. So the black colored stool are usually seen if there is some sort of upper GI bleed, so it is going to give the stool a black color, because the black pigments that are formed from the blood, they coat the stool and the stool appears black in color. So it will raise the concern that the child or the baby is having some upper GI bleed, and you need to rule out that whether it is some sort of HDN, whether it is gastritis, or some other causes that are causing the blood loss from the upper GI tract, and proper workup will be required in such cases. In the neonates, another important cause of the blood in stools or melena may be HDN, hemorrhagic disease of newborn. In that case, the blood may be seen with coming out from the other areas as well. Sometimes the mothers are concerned that the blood is coming in the stool within the first few days of life in a female baby, but when you see some blood is coming out from the vagina. So it is normal in the normal female babies. It is known as the withdrawal bleed, and because of the hormonal withdrawal, because normally when the baby is inside the uterus, so what happens, the normal circulating estrogens from the mother are also causing the changes, some sort of changes within the epithelium of the uterus. So what happens that when the baby is born, now the circulating estrogens are lost. So by the 5th to 7th day of life, the female baby may start having some small amount of pervaginal bleed, which sometimes mixes with the stool and gives the stool a color, or sometimes the mother think that if the blood is coming out from the urethra, from the blood is coming out in the urine, so in that case you need to examine and reassure that this is the withdrawal bleed, and this is because of the hormonal withdrawal that the baby is normally exposed to when the baby is inside the uterus before birth. So this video was about the colors of the baby poop, how the color of the baby poop can help you in leading towards a diagnosis, when you need to reassure the parents, when you need to do workup, when urgent treatment is required, when imaging is required, when you need to admit the baby or the child. So all of these colors help you in getting some clinical information and doing the best management for the babies, so that to improve the outcome. So we will be back with another video tomorrow, uh, with some routine health problems. So the purpose of our channel is to provide you a little bit information. The major information you can get from the books, but this is the information that is the common information, and sometimes you may not be able to go through the book for everything that you see. So these videos are going to help you in gathering some of the information in your day-to-day problems, and this will improve your clinical knowledge, and it will also help you in your clinical practice as well. So stay tuned to the channel and share and subscribe the channel as well, like the videos and give us your valued feedback, so that we can improve the videos, we can improve the sort of information that we are providing to our audience. So thanks a lot, stay tuned to the channel. Thank you.